In the last several months, there's been a lot of speculation about what 2024 Medicare and Social Security was going to look like. Well, we don't have to speculate anymore. The guesswork is over because all the numbers are now out. And so in this video, what we're going to do is look at the changes that are occurring to Medicare, specifically the cost from 23 to 24. And then I'm going to cover the three crucial changes to Social Security, and including that pay raise you're going to get. Now, it's not as much as in previous years, but it is better than nothing. Let's get started. All right, so let's begin with talking about the Medicare changes, and then we'll conclude with Social Security. So first off, as you know, Medicare is broken into two parts, A and B. A is called hospitalization, B is called medical. A is the inpatient part of Medicare, B is the outpatient. And so really few changes, but I do want to highlight those so that you're aware of them. Of course, for most people, there is no monthly premium for Part A, and that's going to continue on, of course. If we have 40 quarters paid into the Medicare tax system, then we get premium-free Medicare A. We'll talk about those who have to buy it here in just a few minutes. Now, as far as the gaps that exist in original Medicare, on the A side, there's actually three of them. And so the first one is a deductible. And what this simply means is that if someone goes to hospital and they have original Medicare, they have to pay a deductible. This is what they have to pay, and then Medicare begins to pay after that. And this actually covers us for the first 60 days in the hospital. That's all we're responsible to pay, is that deductible. This deductible went up just a little bit. It went up to $1,632, a 2% increase. And so we go to the hospital in 2024. This is going to be our out-of-pocket expense, again, for up to 60 days. So whether I'm in 1 day, 2 days, 10 days, or 60, doesn't matter. I'm only having to pay that deductible. Now, if I happen to be in a situation where I am in the hospital longer than 60 continuous days, very rare, these are called extended hospital stays. Now we get into daily copays, $400 a day for month 3, and then $800 a day for month 4 and month 5. These adjust a little bit, went up again 2%. So these went to $408 and to $816. Again, these are very, very rare, but just want to note for those that would have extended hospital stays, that's the out-of-pocket cost. And then lastly, Part A also covers skilled nursing facility. This is after someone's had a stroke or maybe hip replacement, so they're going into skilled nursing. Sometimes accidents, falls, injuries will warrant a skilled nursing stay. And so the way Medicare works is the first 20 days, Medicare covers everything. There's no out-of-pocket expense. But from days 21 to days 100, we're responsible for a daily copay. This as well went up just a little bit, 2%, so it went up to $204. So this would be what I'd be out of pocket from days 21 to 100 in 2016. They say right now the average stay in a skilled nursing facility is right at 35 days. Okay, and so Medicare pays the first 20, and then we have to pay daily copays. Okay, so this is what 2024A looks like. Let's look at Part B. Now, Part B is referred to as medical. This is the part of Medicare that's going to pay for everything that would be outpatient related. This would be if we have lab work or an outpatient surgery or maybe an MRI or a CAT scan or something. Part B also pays for things that would include preventive services. It pays for durable medical equipment. It also pays for home health care services after an outpatient surgery. But also it covers all the doctor services. A pays the facility, but B is going to pay the doctors that we either go to see in their office or they come to see us in the hospital and take care of us. They always pay the doctors. All right, now financially, here's what it looks like. 2023, the Part B premium, what we have to pay to have Part B services, for most people, it's $164.90. Now, if we're on Social Security, they take the Part B premium right out of our check. If we're not, then we can set up some kind of auto pay with Medicare, or they actually will give us a direct quarterly bill for the Part B premium. Now, you'll notice there's a plus sign here because some people have to pay more, meaning they're high income. I'll show you how that's changing next year as well. Now, as we look at the Part B premium for 2024, that is going up to $174.70. Again, it'll continue to come out of your Social Security check, or they'll bill you for this quarterly, or you can set up some kind of a bank draft. All right, now this number here is actually 25% of what it costs the federal government to cover you for Part B services. So when you do the math on that, basically what they're saying is that they're projecting that in 2024 it'll cost them $700 a month to cover the average person on Medicare Part B. That's their cost. And so at certain income levels, you have to pay 25% of that cost. That's how they establish that number. So again, you pay 25% and the government covers the other 75%. 25%. But when you're high income, what happens is you have to pay more for your Part B. Actually, 8% of all people have to pay that additional amount. I'll explain that in the next slide. So that's change number one. The Part B premium has gone up slightly. Now, the second change we're seeing in Medicare Part B for 2024 is the deductible. This year it's $226. This deductible is an annual deductible paid once a year. It's a calendar year. It just simply means that we're responsible for the first $226 of anything that is billed through Medicare Part B. And so this deductible is going up next year. It's going up $14 to $240. So again, this resets every January. It is just once a year, so you have to pay the first $240 on the Medicare Part B services. Now, you may have a supplemental plan that covers that, which would be the Plan F, but if you have a Plan G or a Plan N, that would be your deductible for 2024. Now, as far as coinsurance, that's still 20%. And as far as excess charges, if and when we see those, they're very rare, that's still going to be at 15%. So the two changes here are we're seeing the Medicare B premium increasing as well as the B deductible. Hey, if you found this video helpful and you want to see more Medicare information just like it, then go below, right below the video, and you can give us a thumbs up as well as subscribe to our channel. And every time I put a new video, which is about 2 every week, you'll be notified of that video, and others just like you who need this vital information will get it as well. Now, I'd mentioned that there are some people that pay more than that standard premium. Now, again, that standard premium this year is $164.90. Standard premium next year is $174.70. Again, that's 92% of the population, but those that have to pay more are considered to be high income. And what Medicare does is they set thresholds, income thresholds. Now, the income that we're talking about here, folks, is actually called your modified adjusted gross income, modified adjusted gross, and the calculation for that is line 11 on your tax return, which is the adjusted gross income, plus tax-exempt interest, which is on line 2A. So you put those two together, and again, that gives us our modified adjusted gross income number. So now we're looking at 2023 here, and what they did is they looked back at 2021 modified adjusted gross income. And so if you're a single filer that made $97,000 or less, then you paid the base premium. Now, if you're above $97,000, then you have that additional surcharge called an IRMAA. And this is the single filer threshold. So above $97,000, we're going to pay more. And there's actually 5 levels of those IRMAAs. Now, a married couple, the threshold this year is $194,000. And so if I stay below that, then again, each of us would pay the $164.90. Again, if I'm above that, then I'll have an IRMAA. And again, 5 different levels of IRMAAs for married couples as well. All right. And so as we move into 2024, these numbers are changing. And so the single threshold is going to be $103,000. So as long as I stay below that, now remember what's happening. Now we're talking at 2024, and they're going to look back at 2022. All right. So when they look back, if they see a single filer that's going to be above $103,000, you are going to have an IRMAA. You're going to have that additional surcharge added to this Part B premium. And if married couple, again, if you're below, this number is going to be next year $206,000. And so as long as we're below that, again, we're just going to pay our base premium only. But if I'm going to be above that, then what's going to happen? I'm going to have an IRMAA. Now, I'm not going to take the time during this video to talk about all those other than to say this. There are 5 levels of income. These step up based upon your income. So we have these 5 levels of IRMAAs, thresholds. And so the lowest one is about $83. That includes the Medicare B as well as the drug IRMAA, because when we have an IRMAA on B, we always have one on the D side as well. So again, that's combined IRMAA of $83 and upwards to $500. Now, you're very, very high income if you're paying that. And the reason that we have the IRMAAs is, remember what I said, this number is basically you paying 25% of what the government cost them to cover you in Part B. Remember, I said next year it's going to be $700. You pay 25%, they pay 75%. But as their income goes up, they're saying we're not going to offset your expenses as much. And so that's why we have to pay IRMAAs. They say they'll cover 30%, 35%, or they'll cover 50%, and then you're going to have to cover the rest. And so the point is, they just are not willing to offset your expenses as much because of your high income. So that's the IRMAAs. Now, I do want to mention something to you before we move on. That's this. There are times, again, if I'm on Medicare in 2024, they'll look at 2022, that what happens, someone has a life-changing event. They retire or semi-retire, or there's a death or a marriage or a divorce, a situation occurs. There's 8 possible life-changing events where if my numbers are changing, what I can do, I actually can appeal the IRMAA. We appeal the IRMAA using a form called an SS-44. And this appeal is basically saying this: I'm on Medicare in 2024, and I know you're looking at 2022, but I've had a life-changing event. Remember, there's 8 of those. I've retired, I've semi-retired, I got married, there was a death, there was a divorce, and that's changed my numbers. So we're saying in the appeal, don't look back at 22. I'm going to give you 23 numbers, or I'm going to project for 24. And so we can use that life-changing event for 2 years, because they look back 2, I can appeal that for 2 years. So you don't want to take the time to fill out that SS-44. If you're our client, we are happy to guide you through this entire process. So we don't always have to pay the IRMAAs, and sometimes we'll have someone, remember I said there's 5 levels, they may be at the highest level while they're working, and then they retire. They may not move all the way down to below the thresholds, but they move down maybe 1 or 2 steps, and they can decrease that IRMAA. Okay, so it's well worth your time to appeal the IRMAA if indeed you're going to be assessed one in 2024. Now, just before we get into the Social Security changes, I want to talk just real quickly about a few other things that you need to know about if you're on Medicare. First off, Medicare Part A for most people is at 0 premium. As long as we paid in 40 quarters, or our spouse has, then we can get 0 premium for Medicare A. But some people have to buy it. Okay, and so I just want to mention, as we go into 2024, if someone has 1 to 29 quarters, they will actually pay $505 a month for their Medicare Part A. That actually went down $1. And then if we have 30 to 39 quarters, if you have to buy Medicare Part A, it's going to be $278 a month for that. And again, that didn't change at all. All right, so those are kind of the minor variations affecting Medicare Part A. Now, Part B of Medicare, we've already talked about what's happening. We already know that the premium went from $164.90 to $174.70. The deductible went from $226 up to $240. Okay, moving into next year, of course, that's the money that you have to pay out of pocket before Medicare begins to pay anything on the B side, and that, of course, is your premium. The other thing that's happening with Medicare Part B is they've actually expanded some programs that allow people to get some extra help from the government. So if it's difficult for people to meet this, what we have is we have things that are called Medicare savings programs, and you can actually apply for these through Social Security, or you can do it through a state Medicaid agency. And what they actually do, if you get approved for Medicare Savings Program, then they will actually help you with your Part B expenses as well as Part B cost sharing. Another thing that they're increasing is what they call low-income subsidy. And these are people that, because of low income and low assets, are eligible to get help with their Part D premiums as well as cost sharing for their prescription drug plans. And what they've done this year is they're including more people as far as eligibility is concerned. Because the max was 135% of the poverty level or below, you could qualify for these plans. They raised it up this year. Now 150% of the poverty level or below will be able to be eligible for these Medicare savings programs and LIS. All right, thirdly, I want to talk about Part C plans. Now, Part C plans are referred to as Advantage plans, and sometimes people will call them replacement plans. And so when someone enrolls into an Advantage plan, what's happening is this private health insurance company offers an Advantage plan, and they're replacing A and B. So instead of having A and B setting the rules and orchestrating your care and a doctor being involved and Medicare being involved, what happens now is you have a private health insurance company that orchestrates and kind of oversees your care, puts together a network of doctors and hospitals that you can go to, and a series of co-pays with max out-of-pocket set for the year, and also includes a drug plan. And so the whole point is these Advantage plans at this time of the year, and I'm talking about now October 15th through December 7th, this is an opportunity for people to actually switch their Advantage plans. Now, you don't have to switch if you're still happy with your plan, but this is your opportunity to switch a plan if there's something that's better for you, or maybe you're displeased with your plan, or maybe the plan is no longer available. So during these times, we can switch the plan. The plan you're on now will take you through December 31, and then once you make that switch, then that new plan will kick in January 1. Okay, so this is a very busy season for those of us that are in the business. If you don't have someone that can help you with this, we'd be delighted to make sure that you are on the right Advantage plan, because this is your opportunity to be able to make that switch. And then I also want to talk about Part D plans. Now, a D plan is a drug plan. We can have a drug plan included with our Advantage plan, or we actually, if we stay in original Medicare A and B, we can get a separate Part D plans. Now, Part D plans actually started in 2006. And ever since 2006, they really have been improving. Been around a long time now, 17 years. And so what I want you to know this year is that in Part D plans, they actually eliminated the co-insurance on the catastrophic stage. So every drug plan has 4 stages. The last stage is catastrophic. And so if someone gets into catastrophic this year, they've had to pay a 5% co-insurance for their medications. But in 2024, that catastrophic stage is no longer. We actually will be at a 0 copay. Now, we still have stage 1, the deductible, stage 2, initial coverage, which are copays, and stage 3, the donor hole. We still have those, but all those numbers are improving. And so the government really has been working to make out-of-pocket expenses better for people that are on Part D plans. Okay, so that 0 copay for catastrophic. And then next year, what's going to happen in 2025, the max out-of-pocket on drug plans will actually be $2,000. You'll never have to spend any more out-of-pocket, but again, that's not until 2025. And then lastly, I want to talk about supplemental plans as well, because a lot of people that have supplemental plans think, well, we're going through this period October 15th through December 7th. Is there anything that I have to do? And the answer to that is no, you don't, because supplemental plans are written for life. They're not like the Advantage and the drug plans. They're only written for a year at a time. So on a supplemental plan, you do have a Part D plan, probably. So this would be your opportunity to switch drug plans if you need to. The beautiful thing about drug plans is that there's no medical underwriting involved at all for a drug plan. If the drug plan's in your zip code, you can switch to that. So take the time to see if your 2023 plan is going to serve you well in 24. If it's not, then you can make that switch, and your new drug plan would go into effect January 1. Now, also keep in mind that at any time of the year, you can actually move your supplemental plan to another supplemental plan. We have a lot of people today that could be on an F plan, and they want to move down to a G plan, or maybe down to an N plan. And these are ways that you actually can save money. You'll give up a little bit of coverage, but sometimes it's good to make a move like that if indeed it's going to pay for itself as far as premium savings. But this would be the time of the year that you could do it. You don't have to. You actually can move these plans at any time, but a lot of people are doing this. Now, also remember, if you're on a supplemental plan, you also can move to a Part C plan. Now, if you do that, you want to think all that through, because supplemental plans work differently than Part C plans. Your supplemental plan, there were no pre-authorizations, there were no networks. If you go to a Part C plan, you are going to have networks and you are going to have pre-authorizations. Also, supplemental plans to a Part C plan, if you ever want to get off the Advantage and come back to here, in most situations now you have to medically qualify to make that switch. So be really careful. And I know the Part C plans are attractive. They got some nice perks, a low premium, but you're also going to have a different type of insurance. And so you want to be very cautious if you make the move. Not discourage you from making the move, but you certainly want to think all that through, because you are going to have a different type of insurance. All right, so these are things that are going on with Medicare presently. All right, now let's look at the changes coming to Social Security for 2024. Hey, if you've come to the place where you know you're going to have to make some Medicare decision pretty soon and you want to make the right one of the best ways to do this is to go down below, and you'll see in the comment section there, the very first pinned comment at the top. You can actually click on the link there and you will book a call. And you'll book a call with one of our Medicare guides. All the guides with our company, I have personally trained them. They're professional, they answer all your questions, and they'll show you your Medicare options so that you'll be confident in your decisions. Let's get back to the video. Now, the first change has to do with how much of our income is going to be taxable. Now, many of you watching this are no longer working, but some of you are. And so right now, if you're still working, you work for someone, what happens is 6.20% of every dollar you're making is going to Social Security. And then the employer actually has to match that. Medicare, just so you know, is 1.45%, and again, the employer matches that. Now, if you're self-employed, you pay those full amounts. But when it comes to Social Security taxes, not all of our income is going to be taxed by Social Security. There is always a limit. This year, 2023, it's $160,200. Next year, that number is going up to $168,600. Okay? And so once we reach that particular threshold of income, then there's no longer any Social Security taxes that are due. Now, when it comes to Medicare taxes, just so you know, there's no limit on that. In fact, if you're single and above $200,000, you have to pay an additional 0.90%. And if you're married, a couple filing a joint return above $250,000, you got to pay an additional 0.90% on Medicare. All right, and so that's the change for taxable income. Now, the second big change has been the COLA. Now, COLA, of course, stands for cost of living adjustments. This just came out because what happens is the government takes a basket of goods and services, and they look at this in the third quarter of 2022. Different items that are in there, medical expenses and housing and transportation, different things. They take that basket of goods and services in the third quarter, and then they compare that through the third quarter in 2023. And whatever the difference is between that, percentage-wise, lets us know then, are we going to get an adjustment? In other words, as there have been inflation that is now eroding our Social Security checks, and so because there is, and there has been for several years now, we get this adjustment to our Social Security check based upon comparing 2022 third quarter to 2023 third quarter. Of course, there has been inflation, but in this basket of goods and services, the change was 3.20%. All right, and so that's going to affect 71 million Americans who are receiving Social Security benefits right now. On the average, on the low side, most people's checks are going to go up about $50. On the high side, probably about $110 or so. All right, so everyone's going to get an increase to their Social Security checks, and so when they get those direct deposits in January, they're going to see that 3.2%. Now again, it's not a great amount, certainly a lot less than last year, 8.7. Year before that, 5.9%, but it is higher than the average. In fact, the last 20 years, the average was 2.6%, so we're a little bit above that 20-year average. So everyone's going to check is going to go up some. If you're on Medicare, of course, they're going to take $14 out of that, but they're not taking it all. All right, so lastly, though, I do also want to talk about earnings test. And this affects people that are still working and earning wages. And if they're taking their Social Security before they have reached their full retirement age month. So if I reach full retirement age month, let's say right now, I'm shooting this video October of 13th of 2023. If this was my full retirement age month, I would no longer have an earnings test. But if I'm taking my Social Security anytime between 62 all the way up until my full retirement age month, if I'm still working, then if my income from wages are going to exceed a certain limit, then that's going to have an effect on my Social Security check. They're actually going to reduce that check. That's what we call the earnings test. And again, once you hit full retirement age, we have no earnings test, but prior to that, we do. And so these two numbers here have to do this. This number here is all the way from 62 up until the December before the year I turn full retirement age. So if I turn full retirement age this month, October of 2023, that would be 62 all the way to December of 2022. So the year I turn, then the earnings test goes up. And this year it's $56,520. And so in my example I just talked about here, if this was my full retirement age month, October 2023, that means January 1 of this year all the way up to September of this year. During those months, I could have made as much as $56,520. And so if I exceed these limits, what happens in this lower threshold amount, for every $2 above I make, they take $1 out of my Social Security benefits and they front load that. So I'm above, let's say $5,000 above, every $2 above they take $1 out, they're going to withhold $2,500 of Social Security checks. And then the higher tax amount, earnings test amount, for every $3 above, they take $1 out of my check. So let's say I'm over $6,000, $6,000 above, they're going to take $1 for every $3, so they're going to withhold $2,000 out of my benefit. They front load that amount and then they turn on my Social Security checks. And so my point is, we have earnings test until we hit full retirement age. Now, once I hit that, we have an earnings test. We can make as much wages as we want. Now, also remember this, when it comes to earnings test, this has nothing to do with pension income, annuity income, any kind of distributions from IRAs, 401ks, nothing but wages and net self-employment income. That's all they're going to test. Anything else would be off limits. Okay, so what's happening as we go into 2024, these numbers are going up, so we actually can make more money. So the numbers are this. We are $22,750 $320. So that went up a little over $1,000. And this one went to $59,250. So again, if I make $2 above that, they take $1 out. If I make $3 above that, they're going to take $1 out of my Social Security benefits. So we've seen an increase for this, so we actually can make more money. All right, so those are the main changes that are occurring to Social Security in 2024.